All right, let's go ahead and approve our agenda if we could, please.
If you might want to do a roll call first.
The what?
Roll call.
Oh, roll call first. I forgot. Do you want to start, Antonina?
Sure, I'm Antonina Tantillo, City Administrator.
Susan McLaughlin.
Tish Gallagher.
Dr. David Bechtel.
And if I could get, does anybody have anything to add to that? Do we add to the agenda, or is that not allowed with FOIA?
You can like,
You
if
can do
we're,
it
yes,
under general discussion.
yeah, it's as long as it's not something you have to vote upon. You can rearrange it, or you can take something away or table it, but you can't add.
Okay. So I'll entertain approval of our agenda.
Second,
No, you say motion.
I said a motion
Say
to
second.
approve.
Okay, second.
I'm so confused.
I know.
I'm sorry. The minutes that we have already been approved, I believe, last time, so
So yes, the ones that are here in
Yeah,
the
so-
packet.
we'll put those off until next time. Old business, in March, I went before city council and gave the first report of the Board of Health activities. And I think that went well. You know, there were one or two questions or comments, but overall, it went well and seemed to be accepted okay. One of the Nerman Chewbacca said that he had posted something, I guess, back in the fall about mental health. So he was interested and said, you know, if you think I can be of any help, to call, to let him know, because he's got a special interest in that. So that's good to know. Articles, I started an article on mental health and realized that, oh my God, it's a lot.
It is.
It's a lot.
Yes.
So what I'm proposing is that I finish mine as an introductory sort of what it is. And I just started out with, what do you think of as health when you think of health? And, you know, here's the definition of, you know, physical, emotional, mental kind of health. And kind of go from there, and then maybe do one on substance abuse, that, you know, then we can do that together, or you can do it.
Yeah.
And then one on kind of when do you call for like emergency help? And
who do you call?
Jamie,
Mhm.
yeah, who do you call and what can you expect and who's gonna come? You know, those kinds of
Yeah.
things.
That's a good idea.
I mean,
So do a
like
little,
crisis,
do a little series.
Suicide prevention, you can do like different things.
Right, right. And what we might then wanna do is do one just on a bunch of resources, you know? So does that sound like
Yeah,
a
I think so,
plan? And
yeah.
Good
um,
idea.
I always say.
I left you out of it because, you know, you never know what's gonna come up that we might need the doctor to write something on. So I thought, we'll leave that, but I think that would work better because Terry doesn't like them to be too long, and I'll have to check on that, whether it's 600 or 800 words, but,
I always
and
say,
I tend to be really wordy, so that's problematic for me, but anyway. So if that's okay, we will move forward with that. And so Tish doing the general kind of introductory, why it's important kind of thing. And then Susan with the substance abuse. And kind of recognizing, you know, because some people don't recognize when a loved one is using those. And then Jamie, hopefully, I don't know when she's done school. We'll leave hers till last,
Yeah.
so she might be finished by then. And then we'll go from there, see what else we might need. So we talked about looking at our city code and whether we need to change it. And interestingly enough, our beloved city administrator over here had pulled some from other places. And darned if ours doesn't look pretty good compared to some of the others.
Yeah, a lot more in depth.
Yeah, and she also gave us, and you have this in your packet, the Delaware code for local boards of health. Oh my God. They talk about cholera.
Wow.
It's gotta be old.
That's
So,
good.
yeah, I mean,
Usually there's.
I was reading it and they're talking about wash houses
Yes,
and,
bathhouses, I know.
and I'm like, what?
Oh, wow.
Public laundries, yeah.
Yeah, yeah,
Wow.
and wash houses, and are wash houses
Or
the same as?
slaughterhouse.
And slaughterhouse, well, but I do remember,
Mhm.
I don't think he was slaughtering animals back there, Mr. Tobin,
Mr.
but I
Tobin,
remember big
yeah.
hunks of meat
Meat,
hanging back
yeah.
there
Oh,
with the
sure.
flies and.
Ugh.
Yes, but they do, and they mentioned privy wells and,
So what is a wash house?
I'm not
It's a
sure.
public wash house.
It says public wash house.
Is it like?
Of any person suffering with an infectious or contagious disease.
They're not permitted to.
So I
And
thought
the
maybe that
employee.
was a place you went to bathe.
Mhm.
That's what it sounds like to me.
Yeah,
Okay.
so there's laundries and there's wash houses,
I mean,
cause why else would they?
Well, would it be
willing to-
like bathhouses when you're at swimming pools, or would it be like
Yeah.
at the beach when you go in to change your clothes?
that's what I'm thinking,
Yeah.
like a campground,
Campground
yeah.
and stuff like that is what I would think.
Mhm.
you
Yeah,
know.
yeah.
But I think
Because not everybody had running water and
Right.
back in the day,
right back in the day.
um,
You can't sleep in such public wash house. Well, that's nice to know.
yes, yes, but yeah, when it
But-
got to the neglected privy well, I was just glad I wasn't on the Board of Health back then.
Mhm.
So it's fun to read, but it's like, wow.
Mhm. The reason I included it was because it is referenced in our code.
Yeah. I did wonder whether we were in violation of this, though. Members need not be residents of the city of Newcastle. This is on the very first paragraph. Oh, this is ours. Never mind. Wait a minute. 3 to 7 people, and one should be a physician duly authorized to practice medicine.
And number, we have, this is the one about immigrants with, have been exposed to infectious, actually.
I'm sorry, I can't hear you. If you could speak up when you.
I was just saying this one that they have about exposure to persons who've been exposed to infectious disease. That could be like TB or whatever.
Sure,
Yeah.
sure.
Mhm.
Well, also just think about, you go to the doctor now after COVID and they say, have you traveled out of the country? And, you may have a disease
Yeah,
when
I
you come
mean,
back.
it still plays
Oh, yeah,
Right. It's
today.
just-
It's just
The verbiage
funny
is a
to-
little scary.
yeah.
when I saw cholera, I was like, oh my gosh.
Mhm.
But then if you go past this, see the Board of Health stuff from Newark and from Lewis and Ellesmere is in here and Rehoboth. And they're pretty
Similar?
minimal.
Mhm.
And your comments didn't come up
I
on,
see that. I'm actually
Yes.
sure they did. I
um,
can,
and I couldn't get them on my iPad, but when I went to my laptop, I was able to get them, Antonina, so
huh,
I don't know whether it's just a laptop thing. I have a new, iPad thing. I have a
okay.
new one and I'm not sure that I have all the right, stuff
Right,
on it
right.
to open something like that, Anyway, Antonina did have some comments and questions that I responded to just from my own self, but like make rules and regulations for the conduct of his business. We don't have any rules and regulations for the conduct of our business. So that's why we have the planning commission's rules of procedure just to take a look at.
Yeah, and their rules
something.
are not gonna be perfectly applicable to yours, because they, you know,
Right,
hear
right.
development plans and things like that. But if you just wanted to reference them, if you wanted to make your own rules, then
Yeah.
you're more than welcome to.
Yeah, okay, but we don't have to,
Yeah.
yeah,
Yeah.
yeah.
You're just authorized and empowered to.
You did, I don't know whether, you must have seen
Yes, I did.
my message.
Yes. I just responded to it a little while ago.
Oh, okay, I haven't seen that then. On the second page, under C, consult with Delaware, Department of Health, Division of Public Health, whatever, on disease prevention and report dangerous diseases to the Delaware Department of Health. And that brought up the question of COVID.
Right.
And that's what I was told, that there was no involvement
From the local level.
from us, as a board
Mhm.
during COVID, which just kind of shocked me.
Was that a local decision?
I don't know. I
Okay.
don't know, or whether it was a statewide kind of
Mhm.
thing. I mean, I was told certainly that, you know, it was a novel virus, nobody
Right.
knew anything about it,
Mhm.
so. But I think as information started to come out, we could have at least perhaps helped interpret what some of the things meant within the broader scope of infectious diseases and all.
Right.
Um,
Or at least help to educate the public.
Yes,
Yeah.
exactly. I mean, I
Yeah.
still think that's probably our big role at this point,
Mhm.
so. Yeah, you know, like that sign, that those big electronic signs that they
Mhm.
have
Yeah,
the same message on it
right.
for like a year,
Mhm.
you know?
Right.
So it becomes background, nobody,
Yeah, yeah. It's not new
Sees it.
information.
you don't see it anymore, so
Yeah.
if you change it once in a while, then people will read it again. Simple things like that, that I think the Board of Health probably could have done.
Yeah.
But it was a weird time
It
Mhm.
was,
for everybody, so,
and there was daily reporting from agencies. I mean, we were mandated for daily reporting
Mhm.
if you weren't. Like, it was crazy.
Yeah.
Who was mandated?
The state mandated, we had to turn
Who's we?
any of the agencies that were out there working that had clients, whether it was group homes or
I
like
see.
methadone clinics or anything that, you know.
it was still
affiliated-
going
Oh,
on.
yeah, we were still, I mean, I worked in the field, I worked in my office.
Yeah,
They just moved, like, you called down the hall, and they came in like twice a day and cleaned your office and
Wow.
everything.
Twice a day.
Yeah, well, in the morning before I came, and then in the afternoon, I had to get out of the office and clean again. And then we had, mandated COVID testing, like, so many times a week, and it was crazy time. And then if somebody like, well, I was involved with group homes, methadone, regular outpatient treatments, but all of the agencies that were involved with health and social services, everybody was mandated to report. Like, you had to call in, you had to send your statistics every day. So,
And you're sending them where?
to the state,
Who-
I think it
who-
was public health
Mhm.
that we sent
Should
it
have
to.
been.
Okay.
Yeah,
Yeah.
I mean, every day. Or they were on the phone, you know, so,
Yeah, because they had the daily reporting and the numbers that they would post every single day.
yeah.
That makes sense.
So,
So I would presume that they were in charge then of the town.
mhm. So I was
Making
thinking like somebody here
recommendations.
in the town or something, like, I don't know what department, but.
probably went to the city administrator. huh?
Mhm.
Yeah,
Yeah. I mean, I was in Townsend and we had regular calls with state, like the governor's office, and then we get information from the Department of Health and things like that. But local decisions like whether or not to close your parks or things like that, that was left up to you. I think at first there were mandated portions of that, but then eventually it was, you know, the local decision.
Mhm.
So, but maybe, you know, we add something about involvement during an event like that or something, you
Yeah.
know, and, you know, public outreach and
Like the measles.
yeah, promoting vaccinations and
And stuff.
things to mitigate. Are you still seeing elevated numbers?
No,
Okay,
the COVID has definitely dropped
Yeah.
down considerably.
yeah,
I have seen a lot of flu the past couple weeks.
yeah. I'm sure.
Which is surprising. It's a little late now.
Right. Mm-hmm.
It's usually over by now.
Right.
So back to this,
Mhm.
I think, D is the one, you know, that I think we actually have been focusing on, promoting healthy
Mhm.
communities and healthy behaviors. So, and it's here in E, advisory role to the mayor in the event a state of emergency has been declared, which is what happened in
Happened in
COVID,
COVID.
correct? But,
Let's hope it doesn't happen again.
Right.
yeah. What I would ask though is that you all take a real good look at this, take a look at, you've just gotten them tonight from the other municipalities and just come up with, you know, what maybe we need to change or, you know, to provide, like here's under F4, to provide for the proper collection, storage and disposal of waste, garbage and refuge. Well, we don't really
Right.
have anything to do with that. Somebody else does that.
Right.
Maybe when this was written, that wasn't the
Right.
case.
Exactly.
So I don't know that that still needs to be in there, except maybe, I can't even imagine when somebody would think to call us about that.
Yeah,
Um,
I can't either.
Public swimming and bathing places.
We don't even
We're
have
not
that.
really doing that.
But people do, you know.
I've gone into the river. I grew up
Yeah, I
swimming
mean-
in the river. I've
Probably as a
gone
kid,
into
right?
it.
But you
It's
tell,
cleaner now than it used to be, I think.
That's scary.
but they do, you know.
Public eating places, campgrounds and service stations. Oh,
I don't think, well, one outside of town.
Actually, I'm not aware that swimming in the river is really allowed
Mhm.
anywhere.
Well, it isn't.
It isn't.
But
City.
people get in it.
People do it anyway, but
I know, and that's the scary thing. This poor kid's gonna get.
It's just still here.
It's been a few years,
Yeah,
but
I'm kidding.
on a really hot night, I've gone in at the old boat ramp,
Yeah.
yeah. Just to get wet and it felt good. I grew up in that river.
Yeah.
To provide for the safe and sanitary control of fumigation and the use of insecticides. Now, we certainly asked a year or so ago about what they're spraying on the marshes and shared that information. So there are some things here, I think, the sanitary protection of water supplies, even this city kind of does that along with MSC, so I don't know that we need that in there. So let's take a look, but particularly, I think probably at that section is the one that I think there might be some things that we can maybe remove because people coming after us are gonna look at this and say, wow, that's a lot. I don't, you know,
Mhm.
and I don't know that
Is it
that's,
applicable again?
that's necessary.
and do we enforce all of the laws?
You as the board,
Enforce,
Mhm.
don't know that that's our job either.
Right.
Right. And where's the one about the housing? That I said to you.
Yeah, was that C? No. that
Um,
was-
Oh, B, declare specific properties, matters, or things
yeah.
to be a nuisance and detrimental to the public health.
No,
I mean, I think we can question some things and then we probably take it right to Antonina.
Yeah, and if there was a serious issue though, that we were concerned about, or the code enforcement officer was concerned about, we may take it to you to say, this is, I think that's another section of our code, that if it is a sanitary or health related issue, that we would bring it to the Board of Health,
Right.
to help us make that decision, and then declare it a nuisance. And then the code enforcement officer would then go enforce that and declare them to remove it or remediate whatever the issue is.
Right.
I thought we used to get a report.
Well,
We
we did, and we have a new code enforcement officer now,
Yes,
so.
yeah, he'll start providing.
So we need to get him settled in his day-to-day stuff, and then maybe by the next meeting in July?
Yeah, I think so. We should definitely be able to provide that.
Yeah,
Yeah, because I understand Fury used to attend your meetings and
He
provide
did.
those reports.
he did. And I might be able to dig up one of what. he did,
Yeah,
But
I'm
it
sure we
was,
can
you
find
know,
it
how
too.
many properties
Mhm.
are
Or vacant.
vacant
Yeah.
and how many, if there's any condemned and,
And Steve, who was just here before Milt, he was working on that too. But I don't think, because he was here for such a short time, I don't think, he ever had the opportunity to come to one of your meetings. But Milt will be able to come and provide that report.
so I will, make myself a note to
Okay.
remind Lisa to make sure he gets
Mhm.
the agenda and
That's his
everything.
report too.
Yeah. I
Thank you.
think somebody, it might have been you, sent me his information.
Probably, one of us.
Yeah, somebody did.
Yeah.
Okay, but we'll need to revisit this and kind of put
Yeah.
this to rest, so then we can decide where to go from there.
Okay,
Um,
makes sense.
but maybe in July, we can do that. July has been classically not a time that we have a quorum, but we'll try. Okay, so thank you for that. Any discussion or thoughts, related to the presentation at our last meeting? It was a very good
Yeah, it's very,
presentation.
she is
Oh, yeah.
very good. You know, I've known her for a long time. And, you know, she's worked at a few different agencies, but she's pretty much settled into this. She's a good resource.
She seemed to be.
Yeah, so thank you again
Oh, you're
for
welcome.
setting that up.
Mhm.
It was interesting to see, you know, a nonprofit, kind of private nonprofit and city working together to make something good happen for
Definitely.
people, so that's really cool. Resident survey is on here under old business, just because I don't wanna lose the thought. But I'm still looking at what's available out there and how much information we might be able to troll from those. Cause I don't know how much response would get.
Mhm.
And I'm wondering whether we might get as much insight and information if we're just at some city events and talking to people about, you know, what do you think are the issues? What are your issues related to health and where you live,
So
kind of
maybe,
thing?
like, if we do that health night,
Right.
we would be able to do.
Right, right. So
They might be surprised there's even a board of health.
they might be.
And if you do the, health night, in addition to talking to people, you could always have like a survey established on a website, have a QR code and just have people fill it out while you're talking to them, or fill it out for
Yeah.
them while you're talking to them.
Sure.
That'd be
That's a
helpful.
good idea.
Yeah.
Have someone at the table.
So that we have some consistency in
Yeah,
what we're
to track the
asking.
information.
Yeah.
Yeah, exactly.
Probably have a couple laptops and have people do it electronically too,
Yeah, you could do that too.
which would be pretty cool. Cause then the data are really easy
To pull together.
to pull together,
Yeah.
yeah. So possibly in conjunction. With, what's it called? National Night Out.
Have we decided?
No, we haven't decided on a
date.
date for that.
Do you think that'll be pretty soon?
I would hope so.
Yeah, because it'll take us a while to get people on the, get a group of
Vendors and.
vendors in the health arena.
Well, yeah, National Night Out, I don't know how many vendors or whatever.
Volunteer.
They
groups.
usually have some groups for the kids, like I know the Lions Club participates, I know they had,
They give hot dogs.
Yeah, they give out
I know.
Jimmy.
there's some other groups from last year, I can't remember, because due to the weather, we were never able to hold it, but I know there were a couple of groups signed up. But, yeah, I'll let you know once we decide on.
Right, or we might wanna just do a Board of Health table at that and then ponder something more in conjunction. We had also talked about doing something with the blood
Well, yeah,
drive.
yeah. And
I don't think I mean, there's 5 of us.
Yeah.
You know, and 2 of us work full-time. It's just hard to do too much.
it'd probably be easy to get some people to come in and talk about like diabetes or
To talk about what?
like diabetes or. you know,
Right, right,
Things like
or
that.
to take blood pressure, sure,
Pressures,
I could do that.
Yeah.
Or even the nasal spray they taught us how to.
Oh, yeah.
The Narcan.
No, I
Yeah.
can't, and she can come back for that. But Brian can do that because that's what he does as well. He goes out training.
Yeah,
So, I still have some in my laundry room in case anybody. So, because he does, the hero helps with the county.
I hope they do something with it so that you can keep it in your car, cause to me, that's where I would need it.
Right.
You know, where I'd be most likely to come across somebody and say, oh, I've got something in my car.
Well, he met someone outside of Wawa. I mean, he went, and
The
that
guy
was
went
one of
down.
his places, but
Yeah.
I mean, but he has it on him because that's his job.
Right,
So,
but like, I don't always have pockets, like,
Mhm.
these ants
No, I
don't
know.
even have pockets. so-
Right.
and now that I'm not working in the field, I don't really think about, Narcan and something
Right,
every day.
but you did before.
Oh, my gosh, yes, whatever,
Yeah,
you never knew who was gonna show up.
Yeah. Do you want me to reach out to Council Person Mataway and ask him if he plans on having a blood drive sometime soon and then see if we could coordinate some vendors?
that would be
And
great.
Okay.
When we're gonna do it, like with the seniors bazaar?
Not with the bazaar,
Okay.
the senior center also does, so it's another option. The senior center does a health fair usually every year, I think
Oh.
it's usually in winter sometime
Oh,
or
Is that only
spring.
for seniors though?
Hmm?
Is it only for seniors or is it open to the public?
I think it's open to the
Okay.
public, but I don't know how publicized
Yeah,
that
and
is,
the
you know.
seniors wouldn't be as interested in Narcan and stuff like that. Probably.
Well,
Unless they know someone who may
Yeah,
need
they
it.
might know someone.
you
but,
know, you got a lot of multi-generational households
Right.
and
Yeah.
my next door neighbor could have used Narcan one day when the granddaughter who was living with her went
Yeah.
down.
Well,
Luckily, we
couple
were right
times.
around the corner from the fire hall at the
Yeah.
time and, you know, she was okay, but
I think if it was like outside, like with the fire company or something, people would be more likely, like if they were walking around, like at the national night or something, they'd be more likely to, stop and see it.
Yeah.
Than going to the senior center.
right. So new business, just happy Earth Day to everybody. Disease update, we've kind of tried to look at what's going on, more nationally and how it might affect us. And we talked about bird flu before, H5N1. You might have noticed there's not as much in the news about it lately.
I haven't seen it.
Yeah, well, actually, 60 Minutes on Sunday night had a spot on it. And with veterinarians still expressing concern and kind of watchful wariness. But on Monday then, 4/21, the I don't know what you call it, I get it in an email, and it's called Your Local Epidemiologist. And she noted that it had quieted down quite a bit. There's been no human infections reported since December of 2024.
Oh, good.
The question is why, and the answer is we don't know. There's several possibilities being explored. Stay tuned.
Okay.
And COVID, she reported just what you reported, David, that it's very quiet right now. There's often in the past been a summertime spike,
Right.
but who knows? You know, we didn't have the spike we expected this winter, so it's hard to tell. Measles cases are continuing to go up. The US, and this was as of yesterday, had 839 cases and 7 active outbreaks. Mexico has 451 reported cases, and Canada has 1,045 reported cases, mostly in Ontario. And that one is traced to a large gathering that occurred in New Brunswick in the fall of 2024 that was attended by a lot of guests from Mennonite communities, which are oftentimes under immunized.
Right.
There have been no reports that I can find of Delaware cases, but New Jersey, Pennsylvania, and Maryland have all reported at least one case.
Wow.
So all around us. So just another thing to watch for. And then the other thing that I thought of, which is a kind of communicable disease, it's spring now, so it's time to watch out for ticks again. And allergy season, they are saying that will be brutal this year.
It already is.
Yeah, yeah, it's
That's what
like,
I said.
Yeah.
we already knew that, right?
Yeah.
And the reasoning is basically, you know, our seasons are extending. So they just are extending on both the spring side and the fall side. And so we're exposed to more for longer.
Right. Wow.
So that's the update I have for you. And I wondered, since I brought an update or we've kind of talked about, you know, kind of updated each other, whether it would be worth after every meeting, just publishing a quarterly disease update. You know, I don't know whether people in the community would be interested in reading about bird flu or measles or whatever, or would we need to connect it to how it is important to us?
Well, you know, you just said about the measles cases in our surrounding states.
Not outbreaks,
Right.
but I don't know how they're defining outbreaks either. I didn't get a chance to look at that, but I don't think it's very many
Okay.
for them to call it an outbreak, because
Right.
one state they were identifying as an outbreak, and they had 7 cases at the time
Wow.
yesterday, so
Mhm.
who knows what it'll be, you know, and they've found that once it gets into the larger cities, like in El Paso, what started out as 2, you know, was 11 in like days, so
Wow.
it moves pretty quickly. So I might talk to Terry and just, I'll do that. I don't mind doing, you know, just whatever we talk about as an update in, you know, local kind of communicable diseases, maybe do a little update.
So you're thinking after each meeting,
Mhm.
you'd have an update
Mhm.
and put in the paper?
Sure,
Okay,
sure.
that's fair.
Like a little square or something.
Oh, yeah,
Yeah,
I mean,
yeah.
not anything big,
Mm-hmm.
but yeah. I mean, I do keep track on I follow, like I think I've said before, a couple different communicable disease people who share. And they're really on top of things now because things are still kind of in an uproar in Washington and you don't know what's being watched. So they're
Yeah.
trying to gather data from other sources. They're calling states individually and getting information so that they can share it more broadly. Yeah, so, all right. And we already talked about this one kind of discussion, National Night Out, and we don't have a date yet. Or the health fair, and it certainly could be or a health fair. We'll play it by ear, I think. And the last thing on here is, May is Mental Health Awareness Month. And their color is green, sort of a Kelly kind of green. And I just put green ribbons around town. I wondered about that, we put up those teal ribbons
Yeah.
for
I think it's ovarian.
ovarian. I wondered, do we have to get approval how do we do that?
I think we should, reach out to the mayor and ask her for a proclamation to recognize May. And then we can coordinate a date and time to put the ribbons up.
After she'd do the proclamation at the city council meeting?
Yes.
Okay, so that's not a lot of time, but
No, it's not, but
I don't
we
know how
can,
hard it is. Who ends up doing those? Do you do those?
yeah, I'll work with her to do them.
The
Yeah,
proclamation,
uh-huh.
and then we have to do the ribbons
Where do you put the ribbons?
and trees.
The ovarian, cancer runs were kind of just in the historic area,
Mainly on Delaware Street,
yeah.
right?
yeah, for the
And
most
they
part.
tied them on like the light
The light
poles.
post, yeah,
Okay.
or the tree,
Yeah.
Yeah.
different areas, yeah.
We could get ribbons somewhere. I looked to see if they sell it, because like they have whole packets of stuff
Yeah.
for
Yeah,
Recovery month especially though.
the what?
Recovery month, I used to do that all the time.
Oh, yeah,
But
but
I
I
don't know.
didn't see anything about,
I wonder if there's like a nonprofit that we could connect with that may put the ribbons out and may have like a supply of them.
of any local nonprofits that would
Let me think about it.
maybe do
Yeah.
that, Susan?
I'll check,
Okay,
Yeah,
because I know the one agency I worked with, they're trying to sell it.
otherwise, we'll
Mhm.
go get some ribbon, but I know like the teal ones they put up are sort of plasticky. kind of
yeah. they're
Stuff,
like
so they
outdoor,
would, they
yeah.
kind of
The
stand up
outdoor
to rain and
ribbons.
stuff.
And I think they have something like that says like ovarian cancer on it.
I
Ovarian
don't
cancer
remember
month
seeing
or
it,
something, yeah.
seeing it on there, but I remember the ribbons.
I remember the ribbons, but I don't know that I've looked at them that close.
Yeah, yeah, you'd have to get closer to them.
And then I'll save them for the next.
I mean, they had pins and stickers and all kinds of
Yeah.
stuff, but I didn't see the ribbon.
Mhm.
Yeah.
But it would be a neat
Yeah.
thing to do, I
Mhm.
think,
Definitely.
and makes us a little more visible too.
Mhm.
Sure.
And when is the council meeting?
May 13th.
Okay, so I have because I'm away until the 1st,
Okay,
so I'll check. So I'll see what I can do.
thank you.
Mhm.
So they wouldn't be up for the whole month, because we'd wait until
Right.
after the proclamation, right?
Yeah,
Okay, but maybe,
and next year, if we plan in advance, we could have the proclamation in
In
April to
April,
declare
yeah.
for May and then May 1st,
Right,
put everything
yeah.
out.
Put them on for a month.
Mhm.
heck, we could do ribbons every month for something. I'm
Oh,
sure.
sure. And breast cancer month. You
Yeah,
know, all kinds of things.
Yeah.
yeah, like Dewey goes pink in
Mhm.
October,
Right.
and that is a huge
It's a
thing.
huge event.
Mhm.
Yeah. All right, any general discussion from either of you or the masses of public?
I don't know what they're thinking.
Well, just a question. So are we going to do the resident survey at the National Night Out? Is that what you were thinking?
That's
Yeah.
what we were thinking.
Yeah.
So how,
So we'll have to,
did you want to have like printed, something printed so people would write
We could
something
do
down,
both.
or
You could
did you
do
want to
multiple methods, I
Yeah,
think.
we could
survey monkey or something?
Yeah,
You mentioned the
Google-
QR
Yeah,
code.
yeah, you can set it up however you want, Survey Monkey or like Google Survey, whatever it's called, Google Forms.
does the
Um,
city have a Survey Monkey or something?
Yeah,
You
Yeah,
have like
we have
An
you
account?
can,
an
yeah,
account with
or
them?
Google Forms, you could use either. And then from there, you just take the code, the link, and then you can create a QR code.
We just had to come up with a question.
Right, right.
So if you give me the questions, I can create it for you.
Pardon?
If you give me the questions, I could create it for you.
Oh, okay,
But they usually don't have National Night Out until
August,
August. Yeah, so we have time.
Yeah,
right.
So
But-
do you want to do that at our next meeting then, go over questions that we
Right,
might
so
ask?
maybe that's a good point.
Okay.
Everybody maybe come up with some questions. And I think you can look at health surveys online and kind of pick and choose, you know, cherry pick and find a lot of questions. And then we'll pull them together.
Okay.
I don't know how broad,
How many would you want though? Because you don't want.
you don't want
Too many because then you're
No.
gonna lose them,
Yeah,
then they're
make
gonna
it too
go.
cumbersome.
Some people won't do it.
Yeah, that's what I
Too
mean.
many.
Too many. So what are we thinking, like 15 the most?
probably.
I was thinking 3, but.
Oh, okay. I wouldn't think more than 15.
I would think 10
10.
or
I was
less, but
thinking
yeah,
10.
but it will, yeah, and I mean, you can put options, but you always wanna leave for something you might not think about, you know,
Hmm.
too, but it's certainly easier for the systems to work if they have A's and B's and C's that people can just check.
Okay.
Okay, so other than that, any other general discussion? And there are apparently no public comments. Our next meeting is Tuesday, July 22nd. I know you were away that week last year. Do you do the same week every
No.
year? Oh, okay. I just wanted to make sure, because if you did, we could change that date now, you
Yeah.
know, but.
No, I think that's probably fine. Let me
And I
double
know
check.
you're usually
I come back.
between here and
Yeah,
Fenwick,
yeah.
so.
And I think Jen has it that week, the 20. It's in my family.
Okay, well then I would entertain a motion to adjourn.
Make a motion to adjourn.
Yeah, that might be the week that we're at the shore.
Hmm?
Now that I think of it, July 22nd may be the week that we're at the shore. I'll get back to you on that.
Okay, thank you. Cause then we can just deal with that ahead of time
Yeah.
and let the other two know.
We need a second.
Pardon?
Second.
Thank you. All in favor?
Aye.
Thank you.
Thank you, Kathy. Thank you, everybody.
Well,